Hello, good morning. My name is Dr. Behnam. I'm a board-certified dermatologist. I practice in the beautiful city of Santa Monica in Los Angeles, California. Today we are going to demonstrate a pre-op as well as a laser surgery with the fractional CO2 laser. The brand that we're going to use today is the Smartxide Dot laser. And we have our patient.
I've had acne all my life. Obviously I'm here for scarring. I've been very cautious about it. And I'm here with Dr. Behnam today. I'm very excited to get this laser treatment done.
So let's take a look at basically Eric's face. So we're actually also going to show up some of his before and after pictures. So basically, Eric had a lot of acne basically during his childhood, and he just has a lot of acne scars. With respect to acne, there are several different forms of scars. There's box-like scars, there's rolling scars, and there's ice pick scars. And Eric has a combination of a lot of ice pick in the temple area, a lot of rolling basically in his cheek areas, and he has it on both sides of his face. The CO2 laser is the gold standard basically for treating acne scars. Now there are a lot of various treatments that you could do for acne scars, laser being one of them, but you could also do subcisions, saline injections. You could inject the areas with Restylane or Juvederm, as well as like various forms of chemical peels. And sometimes the combination has to be done in order to get the effect that you want to see. So, the indications for the laser CO2 again is acne, by the same time wrinkles, pigmentations, and pigmentation is also known as liver spots, sunspots. So these are all the collective basically indications that we could use the laser CO2 to treat. Typically we have a lot of patients that are a little older that come in basically for the wrinkles and pigmentation, but today we have one of our acne scar patients that we're going to do the laser on. Eric, I know you came in with a list of questions, so what are the questions they have for me today?
Well, first one is how can a laser help me?
So basically what the laser does, it drills very small holes basically, or columns or zones throughout the skin. These are really not visible. If you look very carefully, you could see small dots after the laser is done, and basically those dots each represents a small zone that the laser creates. By creating these zones, the intact surrounding skin basically dumps collagen in there, and as a result basically regenerates the skin. And by doing so, basically it eliminates the acne scars as well as the fine lines, wrinkles, and pigmentation that people typically have on their skin.
Okay. And how long am I going to be out?
So that's a very good question. So traditionally this CO2 laser, again, the downtime was about anywhere between 6 weeks to 3 months. With the fractional CO2, the downtime is a lot less. It's typically about 5 days. You do a lot of the surgeries on Wednesdays, and my patients take Thursday and Friday off, and by about Sunday to Monday they're about to go to work. The first 2 days, I always tell the patients, you're going to be red and you're going to be swollen. There's going to be some crusting as well. By day number 3, the redness and swelling is going to go down by 50%. By day number 4, another 50%. So by day 5, you're just going to have like a sunburned look. It's just going to be red. Okay. The redness after that basically resolves slowly. It depends on basically the individual. But by about 5 days, you just have a sunburned red and you're ready to basically go back to work.
Okay. And how many sessions?
Hello, this is Dr. Behnam again. So it's been about 50 minutes that we have placed the topical numbing. We have done 2 applications, and we have done some areas with nerve blocks as well. So do you feel pretty now?
Yeah, I can't feel anything.
Can't feel anything. Okay, so we're going to get started. Okay, so we're here with our patient. We're about to get started. Basically CO2 fractional resurfacing using the Smartxide Dot laser. And our patient is already all numb and ready to go. So we're first going to treat the affected areas first. Okay. So Eric, how was that?
Too good.
Wonderful. So basically we're just going to do very minimal overlap in these areas. This is the area we're going to go over the temples again. Hello, this is Dr. Behnam again. We just finished using the Smartxide Dot therapy laser, which is a fractional CO2 laser, which is indicated for acne, scarring, wrinkles, pigmentation. We just finished basically using this CO2 laser for our patient here that has a lot of acne scar. So this is about 10 minutes post-op. So Eric, how was the treatment?
It was fine. I mean, it didn't hurt as bad as I thought it would.
Okay, wonderful. So during the procedure, you said that the areas, from 0 to 10, it was about like 3 or 4 out of 10.
Right.
Was that pretty much right?
Right. Yeah, about 3 or 4.
Okay, very good. We did double pass in some of the areas, particularly the temple and the cheeks, because that's where he had majority of acne scars. Overall, right now you can see, he didn't bleed a lot after the procedure. He's a little bit swollen right now. If you focus a little bit, you can see that the dot pattern that the laser leaves behind, and that's typically normal. After procedure, after we put basically the cold ice pack on you, how was the pain? Was it hurting a lot? Was there a lot of pain or not after the procedure?
No, I feel fine right now. I feel good.
So you're just a little bit swollen. Was there a lot of bleeding afterwards?
No, no bleeding at all.
No bleeding at all. Okay, so he's a little bit swollen right now. The swelling is going to increase. At day number, first 2 days, there will be quite amount of swelling as well as some crusting and redness. By day number 3 and 4, the swelling is going to go down by 50%. By day number 5, you're just going to be sunburn red. This is the advantage of using the fractional CO2 laser as compared to the traditional, like the ultra pulse lasers, where basically the entire face piece becomes red, swollen, crusty, and oozing for like... Hello, this is Dr. Behnam from Dermatology and Hair Restoration Specialist. So we have our patient here, Eric, who last week we performed a fractional CO2 laser using the Smartxide Dot technology, and mainly on the face, especially for acne scars. So he's been exactly 1 week out, and basically at 1 week he's just slightly red. So Eric, I just want to ask a couple questions. So the day after, the same day after you went home, how was the pain level?
It didn't hurt too bad. After a couple hours, it didn't hurt at all.
It didn't hurt at all. Okay. That night, did you feel warm or did you have throbbing pain in your face?
I felt warm.
You felt warm. Okay. And with respect to the post-care instructions, we have everybody do cool compresses afterwards at home. Did you do any cool compresses at home when you went home? Right.
Yeah, I got a ice pack.
Wonderful.
Had a little bit of swelling, so I iced it down, and then the vinegar soaks.
Okay, wonderful. The vinegar soaks. Okay, so I always tell everybody that they're gonna get swelling and redness the first couple days. Was that the same case as yours, or it was different?
No, I had a little bit of swelling and redness, but not too much.
Not too much. Okay. And when did the swelling start to go down?
About after the third, fourth day.
And the third, fourth day. Okay, so today is day number 7.
Yes.
So by day number 5, were you able to go out in public without any problem at day number 5?
Yeah, I actually did go out in public after.
Okay, wonderful, good. So with respect to the results, tell me, do you see a difference? You don't see a difference?
I see a big difference. The scars really smoothed out a lot.
Okay.
Like I said, I need like 3 treatments, so this is the second treatment, but I think after 1 more, I think it should be fine.
You should be fine. Okay, wonderful. So, now, particularly we focus mainly on his temples and his cheeks, on both sides. That's where we basically put a lot of the emphasis and the energy in. It definitely looks a lot smoother to me. This is again a week out, and what the laser does, basically it drills basically small columns or zones throughout the skin, and it ablates those areas. And what happens over time is that collagen basically fills in those areas, and it slowly basically, that's how you start to smooth out the whole face. Now it's only been 1 week. You're really going to see your maximum results by week number 6.
Okay.
Now because of his skin color, we have him doing Lomoxil, as well as we're going to start him on bleaching creams starting today, and he's going to use it basically twice a day with a lot of sunscreen. We're going to see you back in a few weeks, and we're going to see how we do.
Okay.
Any questions?
No.
Wonderful. Thank you so much.